Gress.
Chairperson DeRossi,
Here.
Ms. Doherty.
Here.
Ms. Mott.
Here.
3 present.
Thank you. So we're here just for some overall update of the special ed subcommittee. We know that there's a lot going on in progress that they have been up to. And I would like to talk more about also the Dundalk School and what it's going to be used to exactly program for. Yep. Program for there. So if you wouldn't mind just giving us an overall update.
Sure. Do you want to start just with department updates and then we'll talk about the John Dark and then move on? Sure. Okay. Yeah.
Nice to see everybody. So we have been doing a lot of work, talking to a lot of the staff across the district, visiting a lot of the buildings, seeing the programs in action, problem-solving situations as they come up with building-based teams, with special education teams. So it has been a really robust, I think, second half of the year where there's a lot of discussion, a lot of ideas are floating around. People are willing to sort of think outside the box and kind of consider different things. We are meeting regularly with all the cohorts to hear about their month, how things are going, their caseloads, things that they are coming across, difficulties, things that are working well, and again, problem solving in the moment as things come up, particularly around caseload. We do have a lot of evaluation requests for different reasons. Sometimes it's through the community and parents, and other times it's our own staff through the TAT process. And so we are seeing this second half of the year a lot more requests, and so people are feeling a little overwhelmed in that way, but we're working through all of the issues that could be coming up and providing support and, you know, flexibility around all the things that we need to do to support staff. We are also being, we also are listening to the need for training, for formal training opportunities for our special education team. So our school psychologists, our ETCs, our social workers and BCBAs, as well as our SLPs and OTs. And we're building those opportunities either by bringing on outside agencies to kind of present a different kind of format. We're also doing a lot of in-house case reviews, reviewing some of the laws and the regulations, bringing up cases as they come up through the different schools and sort of collaborating to problem solve. So that has been very positive. We've gotten a lot of great feedback about that. And so we now have teams who bring their ideas to us versus us saying this is what we're talking about today, which I think is a nice shift to really meet the staff where they're at. Again, we're evaluating our programs, our CSA classrooms, our LEAP classrooms, our language-based classrooms. We're visiting those schools, talking to the teachers, seeing the students, and really trying to figure out what is missing, what are the strengths, what are the needs, and how can we just build our programming to be much more productive and really meet the students where they're at. So we are having all of those discussions, and it can be a lot of times because it's a lot of information. We are very fortunate in Lowell here to have a lot of programs and a lot of resources, and so we need to utilize them to the best of our ability to really expand and grow our programming.
Yeah.
Sure.
Just one question. I mean, it sounds like you've done yeoman's work in just going out and trying to get all this data and to figure something out for the overall improvement going forward. But do you ladies think you'll have somewhat of a timeline of when you'll have a better idea of taking all the information that you've collected and making a plan?
So this is actually something that we spoke about with one team specifically today about we've been, talking a lot, sort of dumping the information, not dumping, but kind of putting it out there. And so we are making a plan for the end of the school year, sometime in June, to really think about what are the next steps, maybe 1 or 2 things that we can accomplish at the beginning of the next school year to really put formal processes in place to evaluate programs, right? To really identify what we're missing with curriculum or instruction, to see what training staff need, paraprofessionals, special educators, and be able to provide that throughout, all of next school year. So we are now thinking about those next steps to implement for next year.
And long-term, the strategic plan, which I know is not totally, approved yet, there's a huge component about kind of really reimagining, the special education process and services across the district. So for us next year is really a year of kind of coming up with where we're going long-term, right? I think Sewell is certainly coming in halfway through the years, probably delayed what we would have liked to have done in this, if we had, been here, kind of both of us in September, but, so I think that's an opportunity for us to, getting through this year, looking at the programs, kind of take an audit of where everything is and what are we looking to do long-term is really kind of the next step. The training piece, I think, is really significant. I'm not clear necessarily on what kind of historically has been done, but I know that people are really yearning for training, and it's very hard to make long-term change if we don't have people have the skills added. And so one of the trainings we have coming up, we have a contract through the mental health department actually that's been working with special ed for Mass General Hospital. There's a couple of psychiatrists that consult with the district. They help the school psychologists, problem solve some of our more complex students. They also are going to be doing training for all of our CSA paras and special education teachers pre-K through grade 1. And then we're going to open it up, but I think there's some competing trainings for that half day in May for the gen teachers as well that would like to participate in that. So the hope is we can kind of, expand that into the summer of next year, so that we can get staff kind of all on the same page, all with some basic skill set. Because it's great that we have these visions for what we want the programs to be. People know the skills. And I know this is a separate thing, but you've met a little bit with a couple of the UMass Lowell professors around kind of,
Yes.
I don't know if you want to, I know it's not formalized yet,
Yes,
but
yes, we had a long, productive conversation about what our vision would be partnering with UMass Lowell and their School of Education. For students who are coming out as interns, right, in their process to be special education teachers or teachers in general, and how do we utilize the interns before they get their degree to actually allow opportunities for them to work in the field before they get their degree and then move on, hopefully, into the Lowell public schools versus other areas. So there's a lot of things to problem solve around those things, but we are having the conversations and we are trying to start to make the change in small increments, of course, to really be able to engage the university and kind of, support one another.
I thought there was a partnership with UML interns working at the Bartlett.
and at the 80, we have.
So we do have
It's
two
really looking
schools
to expand it.
to expand it to the other schools.
Yes, I'm not sure
More
about Bartlett, that I would have to check, but I know for sure there's 2 at the 80, right?
Yeah.
So kind of you've got a kernel of a program
Yes.
and then to build on it.
Yeah.
So
It's
we
cool
are,
people to hire from.
yeah.
Right,
so-
I think it's great.
For our extended school year program in the summer, we have applicants already. We haven't sifted through them from UMass Lowell, sort of serve as paraprofessionals and support staff. We're also starting the process of inviting them for our tutoring center, which is every Saturday from 8 to 12, where they get to work under the supervision of a special education teacher or an evaluation team chairperson in that way, and kind of gain experience, see what works for them, what doesn't work for them in the moment training. So we are trying to slowly grow all those opportunities.
Yeah, that sounds great.
Sounds like you're pulling everything together and just waiting to disseminate it.
And I think it's, to be honest, it's also picking priorities, but it is the challenge, I think, next. I think when you start to do kind of a information dump on everything and you start to see everything, and then it's a matter of kind of staying in on what kind of the couple of things that are going to be the first priority, it's also a little bit of a challenge, I think, when you get all the, in the place where kind of gathering all that information. John Dark?
Yeah.
So unless there is some other decision that I'm not aware of, my understanding is that John Dark is intended to be, and we have gone with facilities over to the building and kind of explored. The building as is and kind of talked about the what might be, intended to be for to be on campus, right? Right now, between the two buildings, there's approximately 84 kids. They're at 100%, or if, we probably have a couple students just to be quite started, but are scheduled to start. But they're going to be at 100% capacity, if not already, within the next week or two.
What percentage right now is at the 80? I mean, that is at the John Dark from the 80.
So there's 4 classrooms right now at the 80 John Dark, say, the Lowell site. Yeah.
Okay. And how many
There's
students?
6. So there's probably about 24, 26 right now, yeah. But both sites will be at 100%. If they're not already, I know Christine was projected by like mid of April, I would have to look and see what everything is signed.
And what is the age breakdown?
It's pre-K through 22. Not the one site.
Right, so are you taking the older kids and moving them to the Jeanne d'Arc?
They will all eventually be in the building. And
But I mean, for right now, you said there's 4 classrooms at
Yeah.
the Jeanne d'Arc. Those
What's
are the older
age
students.
level?
those are the older students.
Yeah,
That's a whole site. Yeah. Yeah.
But the
I believe
plan
it's
is
8th
it's-
grade through 22 at the moment.
Yeah.
Is it 7th or it's 8th grade?
8th grade.
22.
We were at the 80 last year or earlier in the year than now.
And so they've started since I came on board, those classrooms were open at the start of the school year.
Okay,
So,
so
yeah,
yeah, since September.
Yeah, so they've been there since September, and that school's licensed for the whole site's licensed 8 through 22, age 22. But there's, I believe, 21 classrooms at the Jeanne d'Arc building. So it gives us the ability to not only house everybody, which having to be, mindful about kind of age ranges and everything, but a lot of programs, most programs do it. If you look at a collaborative, the chunk of them complex, for example, like press in one building, they just separate the sites, and there's obviously, I think, a significant improvements to the building. The building is layout, the classrooms are great, the space is great, but there is some handicap accessibility that would need to be done in the building. And then there's some looking at space. We need to make sure we have a gym. It's not really a gym. We have to make sure the space is there. You'd have to have kind of access to that for licensure. Under the Department of Ed regulations for day schools. And then, the question is what happens to the convent, I think is a big question, whether that becomes maybe potentially some offices, potentially some other programming, depending on by the time it's over. We need that.
And the convent is where those 4 classes.
They are, yeah,
right
the
now.
low 80 Lowell is in what's considered as the convent.
Because that was
Yeah.
move-in ready, you could put them right there.
Correct, yeah.
So we
And they
have,
had one handicap accessible classroom because it was on ground level, so if you could accommodate students in that level if you needed to, so it was a lot.
so we're meeting with the city again, the facilities, the joint facility
Yeah.
subcommittee in June 17th, right?
Correct.
And hopefully we're gonna get a better timeline from them about the elevator, the other construction that needs to happen. So that we can, that's gonna be very important for your planning.
Yeah, and then, looking at parking will be a little bit challenging, because you would need to use the outdoor space, which is currently used for parking for busing, because we have a lot of students on minivans, right? So there's some other things.
They own that whole parking lot on 4th Avenue, right?
They own the top end and the bottom between the two buildings, yeah. Yeah, but that like the back end of the building.
Yeah.
I don't know.
Yeah.
Yeah, the street number, but yeah, the top.
Okay, yeah, that's what I was, yeah.
So if you pull, all staff over, you're looking 70 staff members between paraprofessionals, related service providers, administrators, BCBA's. When you pull everybody together, you also increase the amount of related service providers that will be floating potentially in and out.
Yeah.
Right.
So the parking is significant. Yeah.
So
make
they
sure
were gonna
that-
have a way to.
make
For
sure
the buses
students
to
can
come in
get
and
through,
out.
Right.
So that's, those are all things I think Ricky was talking to, Mr. Underwood was talking to us about. In terms of options and things we need to look at, yeah. And then looking at motor rooms and spaces like that inside the building and designing them for the student population, I think it's the basement's pretty open, right? The basement is a very large library in it at the moment, which I think is great. potential also for a gym.
Yeah.
Oh, it's something. else.
Exactly.
So, I think there's lots of opportunity.
I just had a question about, is this all going to be like 80 gold? Or, because there's been different rumors that I've heard of, like maybe a LEAP program or a language-based classroom. Or things to that effect, so it's just gonna be basically, we're saving the money from paying the 80 to
Right.
now be at the agenda.
So the licensure for special ed day schools requires you to identify kind of what population of students are served. Essentially, our license right now for both sites is for students with autism that have that need for a day school. It's not that we couldn't look at something in the future, but I think the intention is to bring them to one location, right? So the consistency in programming is there. You have built-in supports for teachers in one building as well. And then you have other potential things like a motor room that they don't really have, about built-in kind of real motor room like some of our collaboratives have would be great. Service delivery for OTP kind of be in those kinds of rooms. It just kind of gives you the potential to increase it. So we would never add, let's say, language-based kids to that school. We would never be allowed to do that, nor would we do that.
But would we, I mean, in terms of the capacity, let's say the building's up to speed, ready to go. We move the 80 students over. Is there room to take students from other communities?
That's the hope, yeah. I worry a little bit, one, about kind of the timeline of the building, our number of kids in this strand. If we project out, is growing, and so that
Right.
bubble at some point.
We might not have
Right.
room.
Yeah.
But at least we'll be able to survive.
Yeah.
Not have to.
Yeah, we're all,
all.
we're already looking at potentially having to look to add fall, I don't know, budgets necessarily, but something I think we consider. So. Yeah. You could not, just to be clear, you could not add a student that did not have a day school profile and require the services that day school offers to that building, would never be allowed.
Right. You have to stay with
Yeah.
the program.
Yeah.
I'm wondering in the amount of research you've been doing, gathering information about caseloads, it came to mind about the speech language pathologists, because at our last budget, last year, we had a lot of people expressing concern about the caseloads, and I'm wondering if you have a better sense. of
I
how
think
that's-
all of our service providers caseloads are really high, to be honest with you, whether it's our speech language people, our ETCs numbers are really high. Amount of kids, social worker service from special ed are high. So I think that's also a piece of it. We did add in September a speech language position, which we have been unable to fill.
Right, that was always the challenge, right? I mean,
Continues to
I
be.
think during COVID, we added social worker positions
That's good to fill.
that we
Yeah.
couldn't fill.
Yeah. So we continue to, look, and we have, obviously, we had a job fair here, SLP. And then, the HR department actually just sent us a list of all the resumes that went to another job fair, if everybody. I believe there's an SLP on that list.
But we do actually have an interview for it.
Oh,
so-
perfect.
Oh,
Yeah.
good.
Yeah.
For next year,
Yeah.
SLP for next
Yeah,
year.
so we're gonna try to.
Yeah.
Forward.
But still,
Yeah.
so it sounds like our staffing is still on the low side for the needs.
I think the needs of the kids have climbed. I think if you look at our enrollment, it's gone a bit up, I think. But with that has been the rise in just the number of students that are eligible, which is happening across the country, not just in Massachusetts.
Right.
So I think we, like most districts, maybe haven't completely adjusted.
And it also seems like the intensity of the needs of the students has increased, so a caseload of 10 students could look different if they have, 5 times 30 versus 30 minutes a week of service delivery or other things. involved,
Right.
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 So it's not just a caseload, it's also the amount of time that
Right.
is required to service them, so I think it's a little bit of both.
And when you mentioned earlier about doing some professional development about mental health services, is that trauma?
So,
training?
so we have a couple of things. We've been doing tips or trauma informed practice training. When I say we, the mental health department, Sarah Brooks and Drew Rosenshine, Harley. have been doing that all year in a variety of capacities. So Sarah, I think, has taught a class through Lowell Teacher Academy on it, but they've also been doing a lot of that training in the CPT times that were organized throughout the school year in multiple schools. And on top of that, they have a couple of principals that have asked them to go and actually do the ongoing training with their entire staff. So our goal really over the next year is to train everybody and then figure out a way to make sure we can keep it up, because I think that has been the challenge with the turnover in staff. So that's one of the goals for the mental health department. The other thing I think that they've done really well this year, and probably always, but me being new this year, is kind of worked collaboratively with some of the other departments. So they had the contract for Mass General Hospital for Dr. David Rubin and Mona Potter, who are phenomenal. I actually work with Mona in another district in the consultant capacity. Tremendous amount of experience with autism, anxiety, and has a lot to offer. You know, Drew was able to work with Sula and kind of get the school psychologist to kind of collaborate, meet with them on a monthly basis, which I had when I was a school psychologist here years ago. Different psychiatrists that we can meet with to problem solve some of the cases and things that go on. And then the other piece that we asked them to kind of, because of our numbers for students with autism and the needs, was to kind of look at that strand and look, kind of give us some input about their thoughts. They actually came on site, also looked at some schools, looked at some programs. They met with a number of administrators over the day that they were here. And their starting point for this year is going to be doing the training on autism, looking at some interventions, the why students with autism may do some of the things that they do in a classroom, which I think sometimes you do a good job explaining, you know, the staff, and kind of starting from the 30,000 foot down from everyone. So, starting on the younger kids group, because while it'd be great to expand it to everybody, our half-day time doesn't allow that to necessarily happen. And we needed to narrow it to some degree, and the number of kids that are at that age level that are coming in diagnosed with autism that require our services is significant. So we felt like that was the start of the age was the early childhood, first grade.
What's the caseload look like for an average special ed teacher in a resource room setting that they have maybe a full program of work that they're teaching, but also case managing for their IEP?
So we recently were able to kind of get an account of all the case managers and the number of students that they follow. I think an average or a typical caseload would be 12 to 16, 17 students. I think there may be a couple of exceptions. If I remember correctly, maybe up to 20 or 21 in a couple of instances. But for the majority, the average was, I think, reasonable, about 15 students.
So I feel like the district maybe has been able to, the teachers' caseloads while high and busy, or we've been able to kind of, and rightfully so, put the staffing there. I think the related service providers are, I think, the ones, and the ETCs, I think, are the group instructors. ETCs are, you know, north of about 350 kids on that caseload. Not all of them, you know, but there's a tremendous amount of meetings. It's a tremendous amount of paperwork. We're working on compliance, and that has definitely been an obstacle.